Hi, my name is Lin Ran, and today I'm going to do the newborn assessment. So, because I don't have an actual baby, so I'm going to use a pillow for the baby. And this is going to be the head of the baby, and this is going to be the feet of the baby. Um, so, when I first get the baby, first thing I'm going to do is I'm going to use the linen to try off the whole body. And then after that, I'm going to get rid of this liner. So when first looking at the baby, um, I can see that my baby is screaming, and the skin color is pink, and the baby is crying, and baby's vigorous, which is the um, normal assessments for a healthy baby. So next thing I'm going to do is I'm going to weigh my baby. So my baby's weight is around 7 pounds 8 ounces, which is like 3,400 grams. So it's in the normal range. And then after that, I'm going to measure the length of the baby by marking the head and also the feet of the baby. And then after that, I'm going to use um, the measure tape to measure. And the length of my baby is 21 inches, which is 53.3 centimeter. So it's in the normal range. The next thing I'm going to do is I'm going to measure my baby's head circumference. So to measure the head circumference, I'm gonna make sure that it's going to be right above the eyebrows. And it is around 37 centimeter, which is like 14.5 inches. It's normal. And then after that, I'm going to move to measure my baby's chest circumference. So I need to make sure that it's like right above the breast buds, and it's around 32 centimeter, which is normal. And then next, I'm going to measure the abdomen circumference. Um, Now, the next thing I'm going to do is I'm going to check the vital signs. So, first thing, I'm going to use my stethoscope. So I'm going to use the alcohol pads to wipe it. So I'm going to check my baby's heart rate uh, by checking the apical pulse, and I'm going to listen to the pulse for the whole 1 minute. And my baby's heart rate is like 130 beats per minute, which is normal. And then also I'm going to check my baby's respiration. I can use the other hand um, to put on baby's chest to feel the respiration. And then I'm also gonna count the the respiration for a whole 1 minute. And my baby's respiration is like around 30 breaths per minute, which is normal. And I'm going to listen to the lung sounds. So I'm going to listen to all of the lobes of the lungs, and I'm also going to listen to the back of the lungs. So my baby lung sounds are clear, and they're not wet, and um, there are not any crackles. So next thing, I'm going to listen to heart sounds. So I hear some murmurs, but those can just be the functional murmurs for the newborn baby in the first 24 hours, and it should be normal. But then after 24 hours, if we listen to their heart again, but we still hear the murmur, then we need to do some further assessment. And Next thing I'm going to do is I'm going to listen to um, the bowel sounds. So my baby has bowel sounds, and it's heard like a soft bowel sounds, which is normal for a baby. Okay, now next thing I'm going to do is I'm going to check my baby temperature um, by checking the axillary temperature. So my baby's temperature is 98.8 Fahrenheit degrees, or it's gonna be 37.1 degrees Celsius, which is like ideal number for baby's temperature. And for the pain assessment, because my baby can't speak, so it might be harder for us to check baby's pain, but we can check it through like the way baby cries. It might be different, and we might notice it. Um, Next thing, I'm going to check the baby's skin. So the color of the skin is consistent with baby's genetic background. Um, the texture, when I feel it, is soft and smooth. Um, and when I check the turgor, I can just like pinch the skin lightly, and the skin is elastic and it returns to normal shape, like after I remove pinching. And also I see lanugo on baby's body. So lanugo is basically um, the fine hair that covers the baby's body, is usually in the back or in the arms, and this is totally normal, and it's usually going to fall off in just a few days. And then I'm also noticing that my baby has vernix. So vernix is a whitish cheese-like substance covering the baby, and this is this helps to protect the skin when the baby is in the utero, and it's totally normal. And we shouldn't just like try to clean them off, but they're just gonna go off after a few days. Next, I'm going to check if my baby skin has any rashes, and I don't see any rash on my baby's skin. Also, my baby might have the Mongolian spot. So Mongolian spot is usually on the buttocks, um, and this spot is more common in the babies with dark skin races like Asian babies or Hispanic babies. So let's say my baby has the Mongolian spot, so it should be just normal. So next thing I'm going to check is I'm going to check baby's reflexes. So first of all, I'm going to check the Moro reflex. So this is also called the startle reflex. We can check it by just like snapping finger near the baby, or we can just like lifting the baby up and then like dropping lightly the baby. So normally the baby will startle a little bit. And also my baby has symmetric reflexes. Next, I can check the blink reflex by just looking at my baby. So my baby should normally blink, especially when there's some like light stimulus. And I'm also going to check my baby's uh, pupillary reflex. So I can use my pen light to check the reflex. So the pupils should constrict on two sides when I flash the light. And next thing, I'm going to check the rooting reflex. So for this reflex, I'm going to touch one of the cheek of the baby. And normally my baby is just going to like turn her head to this side. And then I'm going to try to slide my finger into baby's mouth to check the sucking reflex sucking reflex because my baby is going to automatically sucking the finger. Um, and also now I can use my finger to feel the, the palate inside the mouth. I feel the soft and hard palate, and they are intact, and there's yeah, they're intact. um, Next thing, I'm going to check the power grasp. I can check this by using my two fingers and put them on baby's hands. So my baby's hands automatically grasp my fingers, which means that she has this power grasp. And I'm going to do the same thing to check the plantar grasp by touching my fingers to my baby's toes. So my baby's toes are going to curve around the fingers. Now next I'm going to check Babinski reflex. So I'm going to check this by writing an upside down J on my baby's foot soles. So there's gonna be a fanning and extension of all toes. Now, next thing I'm going to check the tonic neck. So um, this means that if I turn my baby's head to one side, so like if I turn her head to the right side, then her right arm and her right leg is going to be extended, while her left arm and left leg is going to be flexed up. It's going to be flexed, yeah. And it's going to do the same thing if I turn her head onto the other side. Next, I'm going to check the trunk incurvation by lifting my baby and put my baby on her tummy. And now if I run my finger on one side, my baby is going to like turn towards that side. And now next thing is I'm going to check the prone crawl. So what I'm going to do is I'm going to put my baby on her tummy, and naturally my baby is going to try to push up, and she's going to try to crawl like crawl further, crawl forward, yeah. And then I can also check the buttocks. So my baby's buttocks are symmetrical. Okay, next thing I'm going to do is I'm going to do the head to toe assessment. So first of all, I'm going to check my baby's head. So the general appearance of the head, it looks round, symmetrical, and my baby can move her head freely, right to left, left to right, or up to down. After that, I'm going to palpate the head to feel uh, the fingernails. So I can feel the anterior and posterior fingernails, and they are flat. They are not depressed or bulging, and I don't feel any molding on the head. Also, I want to check if there's any cephalohematoma. So this is like a collection of the blood. So I want to make sure that I don't feel it, and also I want to make sure that there's no caput, which is a collection of the fluid, or like an edema is swelling on the scalp. So next I'm going to move on to check the face. So my baby's face is symmetric. The eyes are symmetric. There's no damage on the cheek. She has normal eyebrows, eyelashes. There's not any abnormal mark. And then I want to make sure that there's no forceps or vacuum extractor marks. And then I see some bumps on my baby's nose, which is called milia. So these bumps are normal, and we shouldn't try to pop them. They're just gonna go away in a few days. Next, I'm going to check my baby's nose. So my baby's nose looks a little flattened, and this is normal. It's because of the result of the birth process. Um, and I also want to make sure that my baby can breathe normally by I'm going to try to like close one nail and see if my baby can just breathe normally with the other nail. Um, and then I'm going to check my baby's ears. So um, firstly, I want to make sure that baby's eyes are going to line up with the outer canthus of the ears. And because if not, if my baby has low set ears, it might mean that my baby has chromosomal um, abnormality, and I need to do further assessment for that. Um, Also, I want to make sure that my baby's ears are normally shaped. I make sure that the ears have ear canals, and then I'm going to do the ready recoil. So what I'm going to do is I'm going to push um, the ear towards, and when I touch the ears, I will try to feel um, the cartilage at the top. So my baby has like cartilage at the top, which is good. And also when I let go, it should just go back right away. And it goes back right away because my baby is a termed baby. Um, and I'm also going to check, I'm going to do the hearing test. So um, the easiest way to do the hearing test is um, we just like look at the baby, see if the baby can recognize any noise or any voice. So if the baby hear her mom's voice, she should just like turn to that side. Now next I'm going to check baby's mouth. So first of all, my baby's mouth is symmetrical, and as I did before, I palpated the mouth, the palates already, and I know that the palates are intact. There's no cleft. Um, and also, when I look at the tongue is in the midline, and it is freely movable. Um, Now next, I'm going to check the eyes. So my baby's eyes are symmetrical. They're bright and clear. And when I look at the pupils are round, and the pupil are equal in size, and they also will constrict when there's light stimulus. Uh, yeah. Uh, and for the coordination, um, there's a little slight nystagmus of the eyes, which is totally normal. The color of the eyes are blue or slate blue gray. The eyelids are above pupils, but there's no drooping of the eyelids. Um, the movements of the eyes, so we did the blink reflex before. So the baby blinked normally whenever there's any stimulus. Um, so which means that my baby has a normal eye movements. And also, my baby has um, edematous um, eyes, but this is normal because there might be some edema for the first few days for the eyes, but then after that, it's just gonna go back to normal. And also, um, I'm going to look at the sclera. So my baby's sclera is bluish, but which is normal, and then after a few days, it's going to turn white. Um, the cornea is clear, and we're supposed to also use the ophthalmoscope. So the ophthalmoscope will help us to check if there's a red reflex present, and there should be red reflex. If not, it means that it's abnormal. Um, and I'm also going to check the conjunctiva. Conjunctiva is nice pink, no hemorrhage. And then I'm going to check my baby's eye vision. It's going to be 20/150, and I can use like an object and I'm going to move it upward and I mean going move it like closer and then further away, um, so I can track, the baby's eyes will track the moving objects. Um, and then for the eyelashes of the baby, um, there's the presence of eyelashes, and which is normal. Now, next thing I'm going to check is I'm going to check the neck. So the baby's neck is short, and there are some creases. There are some creases in the neck, which is totally fine. But I need to make sure that there's not any extra nuchal folds in the back of the neck, because if there are, um, it means that the baby might have the chromosomal abnormality. Um, and my baby neck is freely movable. Next thing I'm going to check is I'm going to check the clavicles. So my baby's clavicles are intact and straight. Um, baby has symmetric shoulder and there's no bulge. Now I'm going to check my baby's chest. So I did the auscultation before for the lung cells. So and also for the breathing for the breathing cell. So my baby has unlabored respiration. Um,